Good day po ulit. So we are Group 4 Blood Banking naman and we will discuss about blood typing and cross-matching. So to have an overview of our topic, let us define these two terms first. So blood typing or ABO typing is done to detect the ABO incompatibility between a donor and a potential transfusion recipient. Therefore, it is the foundation on which all other pre-transfusion testing is based on. ABO typing is done using two types of tests. It can either be forward or reverse grouping. So forward grouping is defined as using a known source of commercial anti-sera. It can either be anti-A or anti-B to detect the antigens on an individual's RBC. Reverse grouping is defined as detecting the ABO antibodies in the patient's serum by using known RBC reagent, namely A1 cells and B cells. As for the procedure, it will be further discussed on the following slide. Cross-matching, on the other hand, traditionally meant the testing of the patient's serum with the donor's RBC, including an antiglobulin phase or simply an immediate spin phase to confirm ABO compatibility. So let's talk first about blood typing. Blood typing can be done using three methods. It can either be glass slide method, which is the commonly performed in the laboratories, and the test tube method, and lastly, the microplate method. There are three options, no, but for this specific lecture, we will limit ourselves only to the glass slide method, also known as the white tile method. So how is this done? So first po, place a drop of anti-A and anti-B reagent separately on a labeled slide or tile. Add a drop of 20% red cell suspension to each drop of typing anti-sera. Mix the cell and the reagent using a clean stick and spread each mixture evenly on a slide over an area of 10 to 15 millimeters in diameter. So tilt the slide and leave for 2 minutes at room temperature. After 2 minutes, wrap again and observe for agglutination. And lastly, of course, record the result. As for the interpretation, the presence of agglutination on the slide indicates a positive result. So generally, blood typing result looks like this on the slide. So this is actually forward typing wherein, excuse me, if agglutination is visible on anti-A and red cell suspension mixture, it indicates that the patient's blood type is A. Same principle applies to the anti-B and the red cell suspension mixture. If agglutination is present on both anti-A and anti-B, this indicates that the patient is blood type AB. If agglutination is not visible at all, the patient must be blood type O. So, yun lang po. Next.
Let us now talk about the steps of forward grouping. First, we need to set the table and prepare the workbook. And then, we will cross-check the identity of the blood sample on the labels, the requisition form, and the workbook. And then, we will prepare 5% suspension of red blood cells and label 3 tubes for anti-A, anti-B, and anti-AB. After this, we will add 1 drop of each of the anti-sera to the marked tubes, and then add 1 drop of the red blood cell suspension to each of the tubes containing the anti-sera. After this, we will put up a control in the 4th tube, and then mix the tubes thoroughly. After mixing the tubes, we will incubate them at room temperature for 10 minutes, and then centrifuge them at 1000 RPM for 1 minute. After the centrifugation, if there is no visible agglutination, we will examine them under the microscope for agglutination. After all these steps, we will record the grading of reactions on the appropriate worksheet. Moving on to the steps of reverse grouping. First, we will set the table and prepare the workbook, and then we will mark 3 tubes for A cells, B cells, and O cells. After this, we will add 1 drop of the unknown serum to be tested to each of these tubes, and then we will add 1 drop of pooled cells from the panel of A1 cells, B cells, and O cells to the respective tubes. After this, we will all mix them well by shaking the tubes. After shaking the tubes, we will centrifuge them at 1000 RPM for 1 minute, And then after 1 minute, we will remove the tubes and observe for hemolysis. If there is no visible agglutination, we'll again observe them under the microscope using the low power objectives for agglutination. After all these steps, we will record the grading for reactions on the appropriate worksheet. Moving on to the interpretation of the results of the different blood typing procedures. First is for the glass slide method. If we see one solid agglutinate, we'll grade it as 4 plus. If we see several large agglutinate, we will grade it as 3 plus. If we see medium-sized agglutinate with clear background, we'll grade it as 2 plus. If we see small agglutinate with turbid background, we will grade it as 1 plus. If we see very small agglutinate and a turbid background, we will grade it as 1 plus W. And if we see barely visible agglutination with a turbid background, we will grade it as W plus. And if we see no agglutination, we will grade it as 0 or negative. If we see mixtures of agglutinated and unagglutinated red cells, we will grade it as MF. And if we see complete hemolysis, we will grade it as H. And lastly, if we see partial hemolysis with some red cells remain, we will grade it as pH. Moving on for the forward grouping. If the sample of our patient is positive for anti-A and anti-AB, we will report it as A. And if the sample of our patient is only positive for anti-B and anti-AB, we'll report it as B. And if the sample of our patient is negative for all of the anti-sera, we'll report it as O. And if the sample of our patient is positive for all of the anti-sera, we'll report it as AB. And lastly, for our reverse grouping, if the sample of our patient is positive for BC or the B cells, we will report it as A. And if the sample of our patient is only positive for the A cells, we will report it as B. And if the sample of our patient is positive for A cells and B cells, we'll report it as O. And if the sample of our patient is negative for all of the pooled cells, we'll report it as AB. And if the sample of our patient is positive for all of the pooled cells, we report it as OH or any other irregular antibody.
Hi, I'm Clyde Naval, and now we're going to proceed to cross-matching. So the cross-matching have two types, the major cross-match and the minor cross-match. So in major cross-match, when the donor's red cells and the patient's serum is mixed and tested, it is called the major cross-match, which is the donor cells plus the patient's serum. And for minor cross-match, it is the donor serum plus the patient's cells. So now for the sample collection for cross-matching, the blood sample from the patient must be collected in both EDTA and plain tubes. For this, we are ordered to perform forward and reverse grouping. So if detection of alloantibodies in the patient's serum is to be carried out, at least 5 ml blood sample in a plain vial is required. The donor sample is collected from the pilot tube or one of the segments of the tube attached to the back. The number given on the segment should always be recorded for proper identification. And now let's proceed for cross-matching for whole blood transfusion. First, we are going with the saline technique. So this technique is designed to detect the IgM antibodies of the ABO system. So as you can see here in the procedure, we first have to label two test tubes, 1A for major and 1B for minor crossmatch, and place 2 drops of the patient's serum in tube labeled A and 2 drops also of donor serum in tube labeled B. Then we have to add 1 drop of 2 to 5% cell suspension. It can be seen as a tomato colored of the donor in tube A and 1 drop of patient cells in tube B. So we mix and incubate at room temperature
for 10 minutes. Then centrifuge it at 100 rpm for 1 to 2 minutes. Then after that, place one drop from each tube A and B on two separate glass slides and examine under the microscope. Then put a drop of saline on each slide to disperse the rouleau. And you have to record the results. So for interpretation, hemolysis or weak agglutination, maybe 2 to 3 cells sticking together, is considered incompatible.
Okay, so I'm going to interpret later because it has also the same results as the other tests.
Okay, so now we are going to proceed to another technique, which is the albumin and anti-human globulin technique. So in here, the addition of 22% albumin acts as an enhancing medium, which it is incorporated along with IAT or indirect antiglobulin tests in cross-matching. It helps in detection of weak reacting antibodies and also IgG antibodies reacting at 37 degrees Celsius. And the other one is a single tube cross-match. So in most of the blood banks where the whole blood is rarely used and only the major cross-matching is performed, the technique of single tube cross-match is employed. So let's proceed now to the procedure. So first we have the saline phase. So as you can see, the procedure, we have to place 2 drops of patient serum in a test tube. A clean test tube, then add 1 drop of 2 to 5% washed cell suspension of the donor. Then mix and incubate at room temperature for 10 minutes. Centrifuge at 100 rpm for 1 minute, and then resuspend on the cell button. Agglutination at this stage indicates the presence of IgM antibodies, which means it is positive. And now for the albumin phase. So we have to add 1 to 2 drops of 22% bovine albumin to the serum cell mixture. Incubate at 37 degrees Celsius for 30 minutes. Centrifuge at 1000 rpm for 1 minute. So hemolysis or agglutination at this stage indicates presence of weak reacting antibodies, IgG. Wash the cell 3 times with normal saline and discard the supernatant completely every time. And for the last one, the AHG or anti-human globulin technique and or IAT phase, indirect antiglobulin test, or the Coombs test, we have to add 2 drops of AHG serum, centrifuge at 1000 rpm for 1 minute, dislodge the button gently, and examine for agglutination. Hemolysis or agglutination at this stage indicates the presence of IgG antibodies. And now for the interpretation. So a blood donor unit is labeled fully compatible with the patient's blood when no agglutination is observed in none of the 3 phases of the compatibility testing. So as you can see in the picture, so this is the recipient's blood in reaction with donor's red blood cell. So in first column, ABO antigens, ABO antibodies, ABO blood type, donor type O cells, donor type A cells, donor type B cells, donor type AB cells. So in the first row, none. So if the antigens is none, the ABO antibodies are anti-A and anti-B, which means the ABO blood type is O. So the compatible ones are only for also the O type cells. And for the A antigens, the antibodies presence is anti-B and the ABO blood type is A. It is compatible with the donor type O cells and of course the A cells. And for the B antigens, the antibodies is anti-A and the blood type is B. So the compatible donor type cells is the O cells and the B cells. And for the ABO antigens A and B, ABO antibodies is none. So that means the blood type is AB. Oh, so the reaction with donors' red blood cells, it is compatible in all types, O, A, B, and AB cells. So this is the diagrammatic presentation of ABO compatibility. And that is all for cross-matching.
And that is all for our presentation in blood banking. Thank you so much for listening.